we have a massive chronic disease epidemic. Everyone has a chronic illness, it seems like. Where did we go wrong? And you would have assumed initially that we would have relied entirely on the earth. Why is it that we seem to be getting sicker and not healthier, and yet we believe that we have the most technologically advanced medicine on earth? It doesn't seem that we've really made a lot of progress. It just seems like we're all becoming sicker. And so the question sought out to answer, why is this happening?
We have been taught to believe that pharmaceutical medicine is the way to treat patients.
Absolutely, and it's a prevailing belief everywhere. Like, everyone thinks that. Everyone believes, I hear it all the time too, like, oh yeah, well, this is the way to actually treat it if you want something taken care of, right? And it's this pharmaceutical chemical medicine.
Not plants, not herbs, not supplements. I mean, I don't know what the right term is, but you talk about pharmaceutical petrochemical medicine versus kind of, God's green earth with all these plants that actually will unlock, the diseases and heal us. And which one's right, and why did we get here? Yeah,
and the question being, where did we go wrong? You would have assumed initially that we would have relied entirely on the earth, entirely on plants, entirely on tubers and berries, and that we would have sustained life and propagated life that brought us all the way in to the 18th and 19th century. And then all of a sudden we had to use chemical medicine because we couldn't propagate life without it? How does that make any sense?
Well, you might be kind of using your quizzical, skeptical mind out there and thinking, why should I listen to this guy? You're Dr. Ron Dummar, Community Health and Wellness. I'm Nick, I'm a patient of yours, and I'm a curious guy, and we're switching up the vibes in the podcast studio today. We're doing the lounge chairs.
Hopefully you'll like it.
We're hoping maybe a different energy comes through here, but in all reality, it's like, well, aren't we so technologically advanced now that surely the petrochemical medicine of the pharmaceutical industry is making us healthier, right? Because we're so far advanced in society, people aren't dying as early of an age. How is this new medicine a bad thing?
Yeah, with something that is so pervading throughout all of our culture, that it is in every city, it's in every community, the way we practice medicine currently, it's a part of every aspect of our life. We would think ultimately that this is obviously something that's making us healthier. And yet we're coming out being rated by the World Health Organization as the 37th out of 40 nations as far as our health goes. And we have a massive chronic disease epidemic. Everyone has a chronic illness, it seems like, right? And immune generated pathology is on the rise in a significant way. So it doesn't seem that we've really made a lot of progress. It just seems like we're all becoming sicker. And so the question that I would sought out to answer, why is this happening? Why is it that we seem to be getting sicker and not healthier, and yet we believe that we have the most technologically advanced medicine on earth?
Wow, I feel like that's a mic drop moment right there, because if you feel like something's wrong, if just everything seems a little off to you, the healthcare system, the model that we live in now, I think we should dive into how we get here, like you said. Let's start with the medical landscape of the 1800s, where we were talking about before this podcast, homeopathy dominated, what was that? Yeah. And again, I'm thinking, well, back in the 1800s, everyone died early and women died in childbirth, and we've made all these advancements. There's that part of me that I think has been honestly trained, socialized into thinking things are better now because we have the system we have now. And maybe two things can be true at once. Mm-hmm. Again, I think we're talking about different things.
Well, sure, there are definitely advancements that we have to acknowledge in Western medicine and allopathic medicine. And there are severe and significant ailments that occur or catastrophic events that occurs in people's lives that our modern medicine is so skillful at. And of course we rely on them for. And when someone really has a catastrophic experience in their life, they're not going to their homeopath. They're not going to their chiropractor generally. They're really going to the established medical system that we have in our country. So let's look at where the pros and cons are in that as well. But when we look at where we were in the 1800s, in the early 1800s, and maybe even throughout the middle 1800s, but it was a landscape of medicine that was saturated by doctors, homeopaths, Native American healers, herbalists, chiropractors, And then also the allopathic medical doctors. But allopathic medical doctors, even through like cholera, for instance, some of these epidemics that were occurring, these allopathic medical hospitals versus these homeopathic medical hospitals were basically in competition for who was going to do a better job in which hospital, what your mortality rate was, essentially how many of these patients could you keep alive. And what we found was that when you go back and look at the data, the homeopathic hospitals had a way better mortality outcome than the allopathic hospitals. So really? Oh, 100%. When you look at it, it was like we were losing in allopathic hospitals somewhere between like 50 and 70% of patients that entered in because
and allopathic is just
like chemical medicine.
Okay.
Chemical medicine. That's what we're talking about. Allopathy is essentially chemical medicine, right? So when we look at that arm of the established medical system, comparing that to homeopathy, these homeopathic hospitals, the mortality rate or the percentage of patients that died were essentially between 3 and 10%.
Now in the allopathic models, a couple of notes here, we talked about bloodletting and mercury. Can you talk about a couple of those? Yeah, so in allopathy, a lot of those conditions that we think about today, like with leeches and bloodletting, even a purgative effect, they would do a lot of really toxic introduction to the body of very toxic substances to try to elicit a purgative effect, to try to get the body itself to elicit this healing response. And to be quite frank, a lot of people just didn't feel it was that successful, and it seemed really aggressive, right? And so there was, what was occurring in the 1800s and early 1900s was that homeopathy was surging in popularity because people preferred how gentle it was and, well, quite frankly, how effective it was, right? It was working and it was gentle. It wasn't near as harmful of an approach, and it wasn't near as aggressive or invasive of an approach. But even doctors, for instance, you mentioned the mercury, it was a common treatment to utilize mercury in a variety of different conditions. But as a result of that, people often got poisoned via mercury exposure. And so that was problematic also. So a lot of people started to say, well, why are we using all of these toxic substances? Why are we using all of these very aggressive and invasive treatments when it seems like these homeopaths who are telling us to utilize these very gentle, very effective, and very earth-focused treatments are actually getting a much better mortality rate than allopathy itself. So we were in droves, the American public was moving over to supporting essentially a homeopathic modus of care throughout the entire United States. What were some of the treatments that in homeopathy, they may even work today, right? But like, what's a homeopathic remedy versus an allopathic remedy at that time?
Yeah, one of the very common remedies is a remedy called belladonna that was utilized, or arnica even. But belladonna was frequently utilized, and they would utilize these substances when the symptoms would present. But sometimes the homeopaths were even playing with or toying with this idea of called prophylactically or preventively introducing it. So let's say that you have an epidemic that takes place in a certain area. Those people who were symptomatic, they could give it to them, but then they would also give this remedy to the people who were non-symptomatic, and it would help their body so that they wouldn't actually get the condition or develop full-blown disease.
Sounds kind of like vaccines.
Yeah, that sounds really similar to vaccines for sure, that you give a really small amount of something. And that it goes to the idea of homeopathy, really. Homeopathy is like treats like, and infinitesimals. So it's this dilution and succussion principle that if you take a substance and you dilute it to a certain amount, you can actually introduce that to the body in a way that's safe, almost like showing a signature of the original disease. You show that signature, you give it to the body, you present it, it looks at it, it studies it, so the next time it sees it, ultimately it can fend off any sort of illness that it sees.
So we're talking about the 1830s now.
Yeah.
a surge in Europe and the U.S. What is that?
Yeah, so there was ultimately a surge in popularity, and this is what I was just describing as well with homeopathy. In the 1830s, 1850s, even up to the early 1900s, there was this growing surge of homeopathy in the United States and in Europe, throughout Europe. Samuel Hahnemann, a German homeopath, essentially began this idea, or wrote a lot about it, really. So he wasn't obviously the originator, but he learned from others as well. But then he wrote a lot and documented a lot of his therapeutics and his treatments. And he was one of the ones that recommended the use of belladonna for
What is belladonna?
certain conditions. It's a plant essentially that they use.
Is it still used?
Yeah, so we still use it in homeopathy. We still use a variety of different plants. These original treatments and therapeutics that were used, 1,000 years ago or more, even like hundreds of years ago for certain, we're still using these plants. And the reason we're still using them is because they still exist on the earth, right? They've been there for millennia, and their effectiveness has been proven over centuries. And so the fact that you think about the number of epidemics that we have had to have encountered throughout generations and centuries of the Earth's existence. How did we get through those? How did we get through those? How did we survive through them? And the way that we survived through them ultimately was with plants, with herbal medicine, with roots and berries and tubers and those chemicals that naturally occur in nature and come from the naturally existing world around us.
Rockefeller, Carnegie, we're talking about the Gilded Age. A lot's changing. So this is a big point for you. We've talked about this before, petrochemical medicine. I never knew that pharmaceutical was like a petrochemical medicine. Walk me through how things are changing in the 19th century.
Yeah, well, one of the things that really started happening as well is that Rockefeller, the Rockefeller Institute, the Rockefeller family, but they had made a number of investments, and they were becoming very wealthy, and ultimately they had really pooled a significant monopoly together and had created essentially a monetary and a financial force that almost could not be matched, right? Rockefeller was, I think in this day and age, would be probably even a more significant financial figure than Elon Musk. We look at Elon Musk nowadays as a significant financial, one of the richest men, if not the richest man in the world. Rockefeller, I think probably we would look at comparative to the other people in society at that time, probably dwarfed the amount that he had comparatively to the rest of the population on Earth. Probably, I would say 2 or 3 times the amount that Elon Musk currently has. So he was able to have a significant influence. Now here's the interesting thing about the Rockefeller Foundation and the Rockefeller family in general, is that the Rockefeller family, John D. Rockefeller especially, actually loved and utilized homeopathy.
Really?
They promoted and supported homeopathic medicine. They loved homeopathy. They used a personal homeopath that they had come to their home and treat their family. So they were very committed to homeopathy. Now, at the same time, they had some relationships, obviously, with the U.S. government and with international governments as well, that were essentially trying to establish a mode of medical care for the country. And the AMA was being established in the late 1800s and the early 1900s, and they were trying to establish this professional medical or medicine allopathic doctor as the main point of care for the United States. And remember, they were reducing in popularity, and homeopathy was increasing in popularity around this time. So much so that literally if you were a wealthy, affluent individual, you utilized homeopathy. You had basically on call a homeopath who would care for yourself and your family and all of your children. Okay, that's the standard. That's the way it was then.
But again, my skeptical mind said, well, weren't they way less healthy back then?
Well, no, that's a good question. That's a good question that you ask that. And my only answer, I guess, to that is, well, I guess they lived. They did succumb to certain ailments or diseases. Here's an interesting thing as well that we have to bring up that you mentioned, based on that. Look at what happened between the late 1800s and 1960. Okay, because this really needs to be flushed out, because we had, over that period of time, a 99% reduction in multiple infectious diseases. Okay, one of those being measles. Okay, 99% between 1900 and 1963. What happened? Okay, and the reason I say with 1963, you know why I'm saying that, right? Because what was introduced in 1963? Do you know? Anyone?
Vaccines?
The first measles vaccine in 1963. And that's really an interesting thing to suggest, because 99% of measles cases were actually, measles deaths especially, had reduced by 1963, the time that we actually decided it's time to introduce a measles vaccine. So you ask if they're healthy or not. Well, yes, we're aware when we look back historically, we can look at all these little points where certain communities had diseases or suffered with certain epidemics.
Right,
but that happens.
A certain kind of disease would wipe someone out, whereas now we'd have something to like treat it, is what I meant. Like they
Right.
probably were eating more farm to table because that was just the reality of life, and we have all these processed foods. But I just meant like you could get really sick and that could be it, whereas now you could get really sick and you're probably going to survive. That's more what I was thinking of, like
Sure.
the advancements of our healthcare.
Oh, absolutely. Well, and yes, and that's what we are talking about, is the advancement of the healthcare. And so severe, serious, catastrophic situations is where our current modern health thrives. Okay? When you look at, even in certain significant situations like epidemics, again, remember the homeopathic hospitals actually outperformed allopathy. Now, there are certain things that have come up where, things like the plague from the past, like we're looking at some of these historical infectious conditions that occurred and wiped out mass groups of people. And so we have certain things like we've implemented, antibiotics, or we have a variety of different key drugs. And I would say that the time period of like the introduction of these key wonder drugs, it was like the 1940s, the late 1930s, 1940s, we were bringing out antibiotics, we were bringing out all these really cool like wonder drugs, and we were propagandizing them to the American public like they were the savior of the world, ultimately. And we are, I think, just barely now, I would say with the help of COVID, we're just barely now having the opportunity to have our eyes opened, or have the layer of pharmaceutical dogma that made us believe that everything that was good and grand about our life presently and about our health was aid or attributable to pharmaceutical chemical medicine. And what we're learning is the reality is it's just not. It doesn't mean that we should throw the baby out with the bathwater. We shouldn't necessarily say goodbye to chemical medicine, goodbye to pharmaceutical, goodbye to allopathy. That's not what we're saying. We want to integrate it as well as possible. So what we need to say is, where is the official and appropriate place for those to be integrated together? And that's what we do in this clinic, ultimately Community Health and Wellness, is we integrate the best of the East, the best of the West. We integrate the best of homeopathy with the best of allopathy, so that ultimately we can give and provide an overall solution to our patients that is going to promote optimal health for them.
Yeah, there's certain protocols where it's herbal focused, and then you might move to something in the pharmaceutical world to address an issue. So it's not as if you're like putting up a wall and saying we never touch anything.
Correct.
That's a pharmaceutical. Like you're like, what works, right?
It's not
What's
us
the least
versus
invasive?
them.
Okay, it's not.
Yeah, it's not us versus them. It's what works, exactly. And where's the science and the data? And do we have the science and the data to back that up? And if not, can we at least do some science and data objectively without trying to get a specific outcome. Okay. Now here's the next little bit that took place is Rockefeller.
We're talking about Rockefeller still. Okay.
Yeah, Rockefeller. He started a foundation. A lot of people don't realize this, but one of the things they did to help separate themselves from some of the philanthropic things that occurred, they did a Rockefeller Foundation, but they also have a Carnegie Foundation. So we often think of Rockefeller and Carnegie like they're two separate families, but the reality is Carnegie was actually owned by Rockefeller, and so it was a separate foundation that he established so that they could maneuver in different ways and not have it attached to the family name. And one of the reasons I think this was established, myself personally, is because of what started to happen where he put certain people over. Basically, he gave money to the American Medical Association and gave money to a group of individuals and an institution that was essentially saying we want to create a professional allopathic focused mode of medicine within the United States. And so what he did is he poured a bunch of money into that. He hired a report. There was a report that was done by the Carnegie Foundation, and it was essentially an assessment of all the medical schools. That's what it claimed to be. An assessment of all the medical schools in the United States at the time. When was this? Late 1800s. And what they found was that it was incredibly lacking, that the physicians and doctors of all kinds were all poorly trained. The schools were all underfunded. Many of them were private, so they relied essentially on the people who were going to school there to actually fund them. And that itself can seem to be a conflict, because if you literally have your bottom line made up by those people who contribute to you, you're kind of on the hook to them, right? And so they did some good things in this report, and they drew out some of the really problematic issues at the time. But one of the things that they also did say is that there's just way too many people claiming to be practitioners of medicine, doctors of medicine, physicians, and so we need to see if we can limit that in some way. But then the Flexner report, Abraham Flexner, he essentially went out and he had studied in Germany and had focused on this German medical education philosophy, and was trying to promote that and create a system within the United States where the medicine was propagated and followed this German medical education model. Okay, so he put out a report where it said, okay, if you as a medical school if you're taking private funding from people and charging them to come, we're not going to consider you a funded appropriate medical school, right? Like, you're not sanctioned by the United States. And then he said, well, if you don't have laboratory, and physiology and dissection and all a variety of different things, which you'd think, okay, those things are good. But then he said, okay, then you're not sanctioned. So he had a whole list of things that he felt like were super important. And the other thing was, one of the main things he wanted to consider is that he wanted to make medical school actually as expensive as possible, which is interesting because we talked about before how they shouldn't be getting their privatized money. But he wanted to make it as expensive as possible, so it was hard to get into. And he wanted to make it long as possible, as laborious as possible, so it would be it would discourage people ultimately from doing it. So over that period of time, the Flexner report comes out. Homeopathic hospitals at the time, we had about 100 throughout the country, and we dropped almost, by 1920, 1918, somewhere around there, we dropped to 20 homeopathic hospitals and institutions. Medical schools, we had allopathic medical schools, we had 600 plus at the time, and we dropped to 50 after the Flexner report. And really, again,
so it affected everyone.
It affected everyone, 100%. It affected everyone. But those were the measures that they wanted to address. And I do think it's important to have standards, absolutely. But those standards, I think, were very specifically honed towards chemical medicine. And that was the other thing, is that Rockefeller was into oil. Oil was becoming a really big thing at the time as well. And they saw this as an opportunity essentially to propagate their oil industry. And so they also had a requirement that they needed to practice in a way that supported essentially chemical medicine. So if you didn't do that, then you didn't receive any funding from the government, you weren't considered a sanctioned school. And so now you look at it, this is where we are. I mean, imagine homeopathy, chiropractors, herbalists, all of those for nearly 100 years had limited to zero funding at all from the government. Whereas the government, and not only that, but the government and the Rockefeller Foundation supported in very big and significant ways the allopathic industry and the discovery and research, scientific research and development of new chemical medicines and pharmaceuticals, which is why we see in the late 30s, early 40s, we start to have this surge of chemical medicine breakthrough, this period of introduction of savior drugs. These wonder drugs are going to cure the world. And now we see even some of them as not so wonderful. And some of them, even antibiotics, we've learned, hey, we have to be careful with how we use these because they can actually destroy a significant amount of gut flora and cause dysfunction and dysbiosis in the body, which itself causes disease.
So there's pros and cons to the way this all ended up.
Oh, 100%. Yeah, there are pros and cons, but the fact of the matter is, what the con is, 100%, is that chemical medicine itself was pushed and funded almost exclusively.
And put on such a pedestal that, like, if you decide, hey, I want to go see a homeopath, or I want to go see a functional medicine doctor, or even talking to my aunt recently, I was like, I'm having this thing with my stomach, I'm not really sure. And she's like, well, did you go to a doctor? Yeah. And I kind of explained, like, well, Dr. Ron Dummar, he's my doctor. But I had to almost abashedly explain why I wasn't going to someone in a white lab coat, because I trust you with my life and I know what you do works, and yet to my own family it was like a very weird conversation. And that's 2025.
Yep, I agree. A funny aside, I actually did for the first 5 years or so of my practice wear a white lab coat. But
you did?
I did, yeah, I used to. I still subscribe to the white lab coat. I think that's fine. I just don't. It's not a part of my practice every day.
I like that, but you know what I'm saying. I know you're smiling, but it's that there's only one way to do it, and the people who seem to defend that one way of doing it, I just they think that we're not about science and that we are quacks, and it's almost like this, like a revolutionary or like a rebellious thing to I just want a more less invasive approach, and I think this might actually work.
Yeah, and that's really astute, Nick, to bring that up, because during COVID, that was one of the requirements in order to even get the approval to move through the production of the vaccines in a very fast and quick manner. And also to basically make it exclusive to say, okay, we can put this government restriction or government control around this simply because there is no other option, right? So when they can claim that there is no other cure, there's no other option, there's no other way of addressing this ailment or this illness, then it allows them to be able to function within the U.S. government in ways that are really problematic to our personal freedoms, especially in the medical world, medical freedoms.
So where do we go from here?
Well, what we need to do, we did want to talk a little bit slightly about Morris Fishbein, because he only adds, he's like the cherry on top.
Oh, please do.
For the American Medical Association. This guy was like an editor or a chief of staff or something like that for the Journal of American Medical Association. Okay, so he published for this scientific journal. And if you look at some of the things that he wrote about, it was his role to say to homeopaths, or to tell homeopaths, essentially that they were quacks, and chiropractors were quacks. And he literally coined that term. So he taught medical doctors through writing in their professional medical journal that there were practitioners who previously were preferred by the American public, but we're now, we have to change the American public's mentality and mind frame around them. So we created all of these terms like quacks, and wrote about them, and chiropractors, like they had no business being in the medical field, and they were anti-scientific, and that there was no backing or reason for them to be involved in the role of medicine and the care of the American public and society. And so this guy, Morris Fishbein, really took, I would call it the propaganda arm. In fact, it was initially, you can look at it, but it was initially called by the AMA, it was like the Department of Propaganda. And that's what he did, Morris Fishbein. He was excellent at writing and excoriating and basically tearing down anything that wasn't considered professional allopathic medicine. He made look like a quack, and he tried to poke fun and poke holes in it, and discourage anyone from even looking at them or talking to them. Which is why in the 60s and 70s and 80s, their medical doctors would literally felt like it was against everything that was a core belief to them to recommend or suggest or even have a patient go to a chiropractor or a homeopath. And now it's completely changed. You look at the landscape where we are now, and you go, well, how did we get to where we are now from 1980s to now in 2025? And one of the reasons that we were able to do that is the Chiropractic Association had to sue the American Medical Association specifically for slander of the profession as a whole. And literally what we found in that court case was that the American Medical Association and the publisher of this journal, the Journal of American Medical Association, and also a lot of medical textbooks slandered the chiropractic profession and homeopaths and herbalists. And so they won, the American Chiropractic Association won that court case. And the American Medical Association was told that they had to get rid of all of the slander and all of the basically negative talk and disparagement about these other practitioners that they allowed to take place in their medical textbooks, which meant essentially they were indoctrinating our medical doctors. For years, they were indoctrinating them. And Morris Fishbein, his role was to essentially indoctrinate the American public. And so for almost, 80 years? But from 1930, 1920, all the way up. But, for almost 80 years, 70 to 80 years, we had a full-on indoctrination campaign of medical doctors and the American public as to what was appropriate medical care. And it became a very religious thing, an ideological, just like you described. And still, we feel that to this day.
I don't know why I feel it.
You feel it.
But I feel like I was programmed.
Exactly. It has been programmed to you, and it's been programmed to the American public, and it's been programmed to doctors. And we are just now breaking free from this. And that's one of the reasons we wanted to call this episode, right, unpeeling or peeling off the veil of the American pharmaceutical dogma. Because that's what it is, right? It's dogma that we were introduced to and that we were taught over so many years, okay? So we have to break free from this dogma, and we have to allow the opportunity for other, like homeopaths and chiropractors and these other physicians, naturopaths, to actually take stage and lead in teaching us about physiology and teaching us about the body and helping us understand how our health works and how we can maintain optimal health overall.
If you want to learn how to maintain optimal health overall, community health and wellness in Heber City, Utah, Dr. Ron Dummar, where can they find you? How can they reach out if they're wanting their labs drawn or they're wanting to schedule an appointment, or whether it's virtual or in person? You have a lot of clients all over the world.
Yeah, you can find us. You can reach out to us on the phone at 435-657-3696. Or what you can do is you can reach out to us online at chwheber.com.
Another episode of the Be Well Now podcast. If you found value, please subscribe, like, give a 5-star review on whatever platform you're listening to. And yeah.
Namaste.